MRI machines are commonly used as a diagnostic tool in the healthcare industry. To find out more about these machines, we've met with Dr. Daniel Ennis, an associate professor in charge of a magnetic resonance research lab at UCLA. Parker Beatty sat down with him at his lab office for an interview.
I'm here with Dr. Daniel Ennis, Associate Professor of the UCLA Radiological Sciences Department and Bioengineering Department. He obtained his Ph.D. at Johns Hopkins in 2004 and went on to do his postdoc at Stanford. And now you're here.
So. I know, right? Almost 7 years, too. I started on April 1st of 2008. And I sort of like that I started on April 1st.
So I'm really curious, what brought you into the field?
I actually got started in the field by an interest in cardiovascular structure and function and physiology. And it became apparent, really not until I was in graduate school, that a really wonderful way to study the heart is through imaging. Big surprise, right? And it was at that point in time, sort of shortly after I started graduate school, I knew I had this interest in studying cardiac structure and function and evaluating health and disease, but it wasn't really until that point that I realized, and then soon thereafter ended up working in a medical imaging laboratory that also had a focus on cardiovascular applications of magnetic resonance imaging. My background is in medical imaging, or at least my training, my graduate training, my postdoctoral training is in medical imaging, and specifically in magnetic resonance imaging. And even more specifically, it's in cardiovascular or cardiac magnetic resonance imaging. So my laboratory is focused on developing MRI methods that are increasingly suitable for looking at cardiovascular health and disease.
So what brings us here is, to discuss, what you mentioned magnetic resonance imaging.
Yeah.
We want to know what makes that machine function. What are the essential features of that machine?
It's a wonderful question. So let's back up a little bit. Amongst the principles that govern our ability to perform magnetic resonance imaging exams is this unusual or seemingly unusual property that the hydrogen in water has charge, which we're familiar with. It's a positively charged proton, essentially. It also has mass. Things can also have intrinsic spin, which is a really phenomenal and fascinating property of some nuclei. So hydrogen has this property of spin, intrinsic property of spin. So just like you can't take away the charge, you can't take away the mass, you also can't take away the spin. And it's those three fundamental properties, spin, charge, and mass, together that give rise to the ability to detect hydrogen or water in our bodies through this idea of nuclear magnetic resonance, which most people now call magnetic resonance imaging. What we really centrally care about, or perhaps rather are imaging when we perform magnetic resonance imaging exams, is the presence of water in all of our tissues. And the good news is that we are mostly water, right? So we have a lot of water in us. And the really interesting thing beyond that is that water actually behaves a little bit differently, whether that water is in a really proteinaceous environment like the white matter of your brain, and it behaves differently if it's in the gray matter of your brain, and it behaves differently if it's in your skeletal muscle or your spleen or your liver or your heart. And so there's this some principles that govern our ability to acquire and generate magnetic resonance images are based on the fact that water behaves differently in different tissues, and that's really powerful from a clinical imaging perspective because it means we can see these different tissues. We can see differences in things like white matter and gray matter. So a really beautiful magnetic resonance image will have contrast, different signal intensities for different tissue types without the addition of a contrast agent, right? And that's actually really, has had a profound impact on clinical medicine, and it's a really just sort of striking and remarkable property of the physical world that we live in, right?
What about the contrast agents? Because we read a book in our class,
Yep.
A nonfiction book. It's called The Disappearing Spoon by Sam Keen, and in that book they mention the use of gadolinium in contrast agents. So what makes, why did they choose gadolinium out of all the elements?
Now the role of this class of diagnostic contrast agents, that they inherently change how those protons behave in their local environment. Okay, so we said before that protons, hydrogen behaves differently whether it's in white matter or gray matter, and that really relates to all of the surrounding proteins that are there as well, are interacting with all the hydrogen bound to water, and in a not obvious way it gives rise to contrast in our images. If we can now add a contrast agent, usually it would be done intravenously, so the contrast agent ends up in all of your sort of perfused tissues, if you will. That contrast agent interacts with water and can change the way, the kinds of signals that we get from water. When the contrast agent is there, the water is there, and all of the surrounding proteins are also there. The conventional class of diagnostic agents, say gadolinium-based agents, what they typically do is they help enhance or brighten the signals that we get when water and the gadolinium chelated agent are in close proximity to each other. So you get this, it's called a relaxation effect, but you get brighter signals. So a really nice application of that is we can inject a gadolinium-based contrast agent chelated to whatever, not whatever, but some certain things that the FDA says look nice. Gadolinium, for example, is highly toxic to us, so we don't want the gadolinium itself injected into our blood. You'll die, which is bad. But when chelated appropriately to other structures, it can be simply cleared through your kidney and through the renal system and passed out of your body, and it has very, very low side effects, meaning hardly anyone is affected by the administration of these contrast agents, but only because it's chelated to something that gets it out of your body. We can inject this intravenously, it'll be in your blood pool, and that means when we start taking images, your blood will be extremely bright. Now, why is that interesting? Well, a surgeon, for example, might want to know before they do a procedure, a surgical procedure, an interventional procedure, exactly the roadmap of your vessels in your chest or your brain. And MRI, especially with the administration of a contrast agent, can give you these what we call vascular roadmaps, show us how all of the vessels are connected and how they may be unusually connected in you because you've had these symptoms that seem consistent with vascular abnormality. So the contrast agents have been really effective for what we call angiographic imaging, imaging the blood vessels. But they have a bunch of other applications as well. For example, they have a different residence time. How long the contrast agent likes to hang out in a particular part of your body depends on the physiology and the tissue and what's happening in that part of your body. So tumors, for example, oftentimes have long residence times for contrast agents. So the administration of the contrast agent may light up the tumor and allow us to see it very easily relative to surrounding and adjacent tissues. Whereas without the contrast agent, maybe you can't see that quite as well. It works especially well in another circumstance where the contrast agent has a longer residence time in the scar tissue in your heart. If you have a heart attack, you end up unfortunately killing off a lot of cells in your heart, and those cells get replaced by just collagen and fibrosis. And the contrast agents like to hang out there for longer than they do in normal myocardium. And so suddenly, clear as a bell, you look at an image and you say, that's an infarct. There's contrast agent there that lights up really bright, and now we know where the infarct is, we know how big it is. Clinicians can start using that information to inform decision-making for that particular patient. What therapeutic strategy is important for this particular patient. And that's just the conventional category of contrast agents, right? Things that have been in use already for 20 years or more.
All right, so thank you so much.
Of course,
for
it was great. Thanks for coming down.
Huge pleasure, huge honor.
Well,
and a lot of fun.
Yeah, awesome.
Thank you.
Of course.